So, woke up with a migraine today, so taking a little resty rest before I have to teach class in like an hour. So I thought, you know what, I'll do some research on migraines. Maybe I'll learn something to help me and make a great video, right? Educational content on neuro. You know what I learned? I learned migraines are the number one neurological disorder according to the WHO in terms of hours lost to symptoms. Then I learned that there are certain areas of the brain that are implicated in migraines by having increased white and gray matter density. And then the other studies that say the exact opposite. And also, all those old theories we had about migraines being caused by like vasodilation don't seem to actually pan out because the medications that would help with that can't cross the blood brain barrier, meaning whatever effect they're having seems to be peripheral first. And also the links to things like insulin resistance or weight. Yeah, those didn't pan out in the more recent studies either. Now, there is a genetic risk. We see it's heritable. If a family member had it, like a parent, you're more likely to get them. Which genes? We don't know. There's a whole bunch. There's not a single one that would predict migraine, but like big clusters of them, and we just don't understand yet. All right. Now, the one thing that does seem consistent is inflammation, right? Because that's associated with lots of pain. And also the trigeminal nerve, which is the nerve that sends most of the pain, touch, and sort of hot and cold sensation to the brain. They think that a lot of the medications like sumatriptan that we use are affecting that nerve first, and that perhaps that's then doing something centrally. And also, inflammatory responses seem to be key, with migraine sufferers seeming to be more sensitive to pain as they engage in a more parasympathetic response. So, heightened inflammation, heightened sort of relaxed state where the immune system can do its thing and you can feel more pain than if you're in a fight and flight kind of mode, like a sympathetic response. And that's probably where some of those triggers like sugar or wine come in because those can often cause inflammatory responses in some susceptible people. Anyway, all that to say, we seem to know fork and squat about migraines, and that's why when you go to your doctor and they're just flinging crap at you trying to solve it, that's because they have no idea what's going on, and everyone has their theory, and none of them seem to have panned out yet. And also auras, like right now, I did take an Imitrex. It helped with the pain, but now I have the nausea rebound. That seems to be from a decrease in cortical activity after a big increase. Except, of course, in the other studies that showed that not happening and people still getting auras. So, yeah, we know forking squat and migraines suck, and that is all.